Do you feel sharp pain on the outside of your knee, especially when you're walking, hiking, or even climbing stairs at home? If so, you've probably been told it's arthritis or that you have a meniscus tear or that you're bone on bone. But the truth is, lateral knee pain often comes from stiff joints and stuck nerves and not structural damage. Hey, I'm Drew, also known as the knee pain magician. For the past 10 years, I've been helping active women in their 50s and 60s overcome chronic knee pain without further use of injections or surgery, only by improving the brain-body connection. And when it comes to lateral knee pain, there are three overlooked areas that most doctors and therapists never even discuss. To start with, knee pain often comes from problems elsewhere in the body and not the knee itself. So one place I often start is by looking at the joints both below and above the knee. So that is the ankle and the hip. So I want you to think of your leg as a chain and everything's connected. The ankle, the knee, and the hip, they're all synced. If the ankle stiffens up, that stress transfers up to your knee. And if you have mobility issues in your hip, that's going to have an issue with your knee, trying to compensate for a lack of mobility elsewhere. And it's not just joints, your nerves matter too. Your nerves control your muscle and soft tissue and help your brain control the movement in your body. And when they get stuck, you can feel stiff, pain, weakness, instability in that area that's affected. So today, I'm going to show you two powerful joint mobilizations, plus a nerve glide that can help you unlock any pain and stiffness you're having on the lateral part of your knee. So before I coach you through these three exercises, I need you to assess and see how the outside of your knee is currently feeling. So in order for us to see which exercise out of the three is the most helpful to you, we need to be able to test and compare to how the outside of your knee is feeling before we do the movement. So a couple different things that you could do at home to see how your knee is feeling both before and after an exercise. First thing you could do is just stand up and, if you're able, go for a bit of a walk. If you have a hallway or space to walk up and down your living room, take 5 steps, 10 steps, totally fine. Just walking back and forth. As I'm walking up and down, how does the outside of my knee feel? On a scale of 1 to 10, 10 being a high level of pain, discomfort, stiffness, etc., 1 being you feel amazing, kind of where are you on that spectrum? So that's one thing to pay attention to. Another thing to pay attention to is just do a little bit more movement-based activity. So if you have some stairs, and you know that stairs often trigger the outside of your knee pain, that lateral knee discomfort, then I want you to do a couple of stairs just to kind of check in and see how you're feeling. Again, give it a grade on a scale of 1 to 10, rank it. Third thing you could do, if you want to do a little bit more movement, is you could do a few squats or knee bends. So say you're at home and you're dealing with lateral knee pain on the right side, you could just bend and extend your knee. Maybe I need to back up so you can see that. Just bend and extend your knee, see how that feels. Maybe you're just going to do a few squats. It's like, yeah, when I squat down, I can really feel the outside of my knee right here. And maybe if I had to, I'd give it, maybe it feels like a 6 out of a 10. You kind of get the drift a little bit, right? Okay, so that's the first thing I want you to do. Okay, so after you've done a thorough assessment, we're going to work on exercise number 1, which is an ankle tilt. Okay, so to address lateral or outside knee pain, we're going to be working on the lateral or outside part of your ankle. So I roll up my pant leg a little bit. And what I want you to do is focus on this part of my ankle. See my ankle bone here? We're just going to go a little bit lower, and that's the place that we want to mobilize. Okay, so if you see me, I'm going to gently step forward with the side that I'm trying to work. Again, right knee pain, you're going to step forward with the right foot. What I want you to do, without moving your whole body or your entire leg, I want you to focus on rotating your foot and your ankle out towards the side. This is called an ankle tilt, a lateral ankle tilt. So at first, I'm barefooted, no shoes, no socks, getting good grip of the ground. And then I'm gently tilting or rotating my ankle out to the side. I return to a flat foot. Back up a little bit here for you. I return to a flat foot. Then I gently tilt or rotate out to the side. It's kind of like you're purposely spraining your ankle. In reality, we're not doing that kind of damage at all. We're doing a simple mobilization. And what you should feel is a deep stretch along the outside part of your ankle. So I'll kind of show it to you from this angle so you can see. So basic tilt. Can I roll and tilt, rotate my ankle out to the side? As I'm doing so, can I find a deep stretch on the outside part of my ankle? You may feel the stretch here kind of transfer and translate to the outside of the knee, potentially even the hip. Obviously, what we're focusing on is the ankle though. So just very gently, you're just going to be rotating. And what I'd like you to do is maybe 5 to 10 repetitions at home. So you notice me, I'm standing up nice and tall. I'm not hunched over. I'm breathing. I'm not holding my breath. I'm trying to relax any tension that's in my body. Gently extending my leg forward and just doing a simple rotation or tilt of the outside of my right ankle. And this is to help open up and mobilize an important joint there in my ankle. That's going to hopefully translate into more freedom of movement, less pain, less stiffness on the outside of that right knee. So again, 5 to 10 reps focused on isolating the outside of the right ankle. This is called a lateral ankle tilt. Okay, so after you've done maybe 5 to 10 repetitions of the lateral ankle tilt, I want you to take a break, stop, rub your ankle or your knee if you feel like you need to, and then I want you to reassess. So for our assessment, what did we do? We went for a walk, walking up and down the hallway, walking through your living room, wherever you have a little bit of space to move, just checking in with the quality of your movement, of your gait. Do you feel like you have less pain, less stiffness on the outside of the knee? If so, amazing. If a walk like that isn't maybe the level of an assessment you need, you can also reassess some stairs. Go down maybe 2 to 3 steps at home. Walk up 2 to 3 steps. See if you feel like you're a little bit more confident in the knee, right? That you don't have to hold on to the railing as much. If you need another assessment even beyond that, you can always do another squat, right? Put more load, more weight on the outside of that knee and see how that feels. So again, at the beginning, I had you think about what's your scale on 1 to 10 basis, 10 being a high level of pain discomfort, 1 being you feel amazing. Where are you on that spectrum? After doing this exercise, hopefully you're better, but you never know. That's why we need to check. Okay, so the second exercise we're going to be working on today is called an open chain hip circle. So we want to mobilize the hip, outside of the hip, to see if we can have an impact on the outside of that right knee. So you can work your hips lots of different ways, lots of different exercises, kind of depending on what's the history of your knee pain and what else you may have going on in your body, kind of what your capabilities are. Sometimes it's difficult for people to lift a leg and to move it because it requires standing on one leg and stabilizing. Maybe you haven't been able to do that level of movement for a while at home, and that's difficult. So keep in mind that you can always adapt an exercise and try to fit it based off of your specific body and your needs. So just because I'm doing it one way, I want you to think at home, if that doesn't work for you, what's another way that I may be able to do this exercise that causes me less discomfort and it accomplishes the same goal. So from this position, ideally you're going to have something to hold on or support. You probably don't have a Pilates apparatus at home. If so, not a problem. You can always use a door frame or a chair to hold on to for a little bit of stability. So once you're standing up nice and tall, you kind of have that support. You're going to gently bend that right knee, bring your leg forward, rotate it to the side, and then rotate it behind you. So I've got right knee comes forward, out, and then back. So it's kind of 3 positions: 12, 3, and 6. 12, 3, and 6. So you should feel the front of the thigh or your hip when your leg's forward. You should feel the outside of your thigh when your knee is away from your body. And then you should feel your butt when you're going backwards. So what you want to be able to do is create kind of a nice smooth circle as you're going through this movement. So we don't want to be really rigid. We don't want to be clumsy. We want to find a nice smooth movement that's comfortable, but allows us to open up that hip joint. And maybe get a little bit of activation on the outside of that hip as well. So notice I'm going one direction. If you need to take a break, you can. Oftentimes standing on one leg is going to be tiring, fatiguing, etc. That's normal. Then what I want you to do is go the opposite direction. So I'm going to go back, out, and then forward. Go back, out, and then forward. So it's just the same movement, but now we're going the opposite direction. So we're going to go counterclockwise. You don't have to do a huge circle. You could do a small circle. Maybe this is more suitable for you at home, with your knees, with your legs. But just try to get a little bit of movement with inside this hip joint. Try to feel the muscles around the outside of your hip and your thigh activate. And then that's it. Then you're just going to shake it off, take a break, and then of course you're going to reassess. So maybe you need a sip of water, go for a little bit of a walk again, try a few stairs, maybe squat, right? Put a little bit more load on that knee, bend in, extend that knee, and see, okay, after I worked my hip, how does the outside of my knee feel? Oh wow, that actually feels a little bit better. If so, that tells you that maybe what you need to do is spend more time working the hip rather than working on the knee itself. Okay, so the third and final exercise that we're going to do is now we're going to do a nerve glide or nerve mobilization, kind of stretching your body, but kind of working your skeletal system in a way that flosses or kind of glides a nerve or nerves that innervate and control the muscles on the outside of the knee and kind of around that region that may help you kind of unlock any pain and stiffness that you're struggling with. So what I like to do is find a nice sturdy place to sit down, someplace that's not going to move and be unstable as you're trying to do this mobilization. Again, assuming that you've got right knee pain at home, you're going to extend that right leg out in front of you. What you're going to do first, if you have a brush, great. If not, you just take your hand, and I want you to rub, just provide a little bit of stimulation so your brain has a little bit better connection to the area that you're trying to work. So I've got behind my thigh, my hamstring, behind my knee, the outside of the knee, and kind of behind my right calf too. So what I'm going to do from this position is I'm going to extend that leg all the way out in front. I want you to think where your midline is. So midline, I want you to think belly button. I'm going to extend my right leg all the way out in front of me. And then I'm going to just barely kind of pull it across my midline, keeping my heel down, and then I'm going to raise my foot and my toes up towards me. So not down and limp, heel down, but foot and toes actively kind of extending their way up towards me. So I've got my leg extended all the way out. So I know that you may have some bow-leggedness in your knees and things like that that prevent you from fully extending the leg. That's not a problem. I just want you to try to do the best job you can and avoid any discomfort. So from here, I already feel a stretch along the outside and the back of my right thigh. So what I'm going to do to kind of exaggerate that is I'm gently going to roll my spine down towards the left. As soon as I even come down this far, which isn't that far, I already feel a big increase in tension behind that right leg. Right now, it's probably beyond a 3 out of a 10. So I'm going to come back up and release the tension. So I don't want you to think like a traditional stretch where you're like really trying to work it. Like we're trying to work a nerve. So we want to be delicate and not really overdo it because that can happen. So again, I'm here, right? Heel down, foot and toes up towards me, trying to lock out my knee as much as I can. And what I'm going to do is gently roll my body forward and extend slightly to the left. So from here, I'm going to come back up and relax. Come down, roll my body forward, kind of like a slinky, kind of one vertebra over the other, kind of rolling my body forward. Find that tension. Oh, wow, it's kind of electrical. It's like a burning sensation. That's the nerve. You're going to come back up, release the tension, and breathe. So you're going to do this maybe 3 to 5 times. Come down, find that tension, come up, breathe, relax. Come down, find that tension, come up, breathe, relax. Last one. Okay, perfect. So that's the beginner version of the exercise. What you can also do from this position, once you go down and find that tension in the nerve in the back or the outside of that knee, from here, what you could do is bend and extend your right knee. Bend and extend. So as I extend and straighten the knee, I really feel that tension of the nerve. When I bend the knee, I'm taking away the tension, right? There's a little bit of slack now. So that feels like there's relief, and then I'm extending, and then I'm going into the stretch. Bend the knee 2 to 3 inches, relax the tension, extend the knee, drive the stretch. So you could do that a few times. You could do that from a tall spine, and then you could do that from a exaggerated position already when your body's rotated or rolled forward. So after you've done that a few times, you don't need to do this 10 repetitions, just maybe 3 to 5 times is probably more than enough for you to really get a good mobilization and stretch within the right nerves that could help release any pain, stiffness, instability that you're feeling on that lateral part of your knee. So after you've done that, I want you to stand up, rub the knee if you need to, go for another walk, try some stairs, try your squats, and pay attention. How does your knee currently feel after doing that nerve mobilization? If you felt better within the outside of your knee, maybe what you need to do is focus more on moving the right nerves so that your brain feels better, more confident about what's going on with your knee, and stop sending out the same pain and stiffness. One of my clients in her early 60s came to me because she was struggling with chronic pain on the outside of her knee. This pain was so bad, she wasn't even able to walk her dog around the neighborhood without limping afterward. So instead of just treating the site of the pain on her knee, we worked on mobilizing the joints in her ankle and her hip. And within weeks, she was already feeling so much better that she could walk around the neighborhood without having the same level of pain. Eventually, after going through the full length of my program, she was able to avoid the surgery that her doctor recommended, and she hasn't had a cortisone shot. So if your lateral knee pain hasn't improved by traditional physical therapy and various steroid injections, chances are you've been working on the wrong thing. But the good news is, once we restore the brain-body connection by improving the mobility within the key joints and nerves that innervate and control the knee, we can find results very quickly. So if you're ready to get to the root cause and finally solve your knee pain, I invite you to schedule a free knee pain assessment with me. And you can do that by following the link at the bottom of this video, in addition to the home screen on my channel. Thanks so much, and talk to you soon. Bye-bye.